Hi everyone, it's Elise Kleckner. I'm doing my case presentation today on pneumonia. So our patient is Mary. She is a 34-year-old female, hasn't been feeling good for multiple days, and she's a nurse at a nursing home. She has been experiencing some shortness of breath that is quite frequent, um, having hot and cold flashes, uh, her chest feeling very tight and heavy, her pulse racing, as well as a cough that is productive. And when she does bring it up, it is thick, sticky yellow phlegm. Her history is Mary has a high risk career because she is a nurse who works in a nursing home around sick patients, as well as the coworkers that could come in sick. She has a past medical history of asthma and mitral valve prolapse. And also, when she was younger, she worked in an environment that was very smoke filled. So she got a lot of secondhand smoke. Her physical exam, she had some slight bluish tint to her lips, had a elevated temperature with no chills. Her pulse was very rapid, as well as her O2 saturation was at 86. Upon listening to her lungs, crackles were heard in the lower lobes, as well as decreased breath sounds. So, diagnostic tests. There are a couple of tests that can be done to help diagnose our patient. We want to do an ABG to test for oxygen levels in the blood, as well as a oximeter, which we already did, which showed that her O2 was at 86 and that her pulse was rapid, as well as a chest x-ray and then a CBC blood test to show how the cells are acting, as well as the WBC levels, because that shows infection. Diagnosis. The suspected diagnosis is pneumonia. This is based on the patient's history of mitral valve prolapse, as well as asthma and her symptoms of fever, tachycardia, shortness of breath, and weakness. Treatment, we would want to possibly do some antibiotics if it is a bacterial infection, oxygen therapy, IV fluids for dehydration, as well as possible needle aspiration to drain out fluid. That is the end of my case presentation. I hope you guys enjoyed. Thank you so much.